You might have seen headlines today saying all forms of hormonal contraception increase your risk of breast cancer by 25%, and that might have worried some of you. So I thought I'd do a quick video to talk about what we already knew and what this study adds. The biggest risks for developing breast cancer are having breasts and getting older. And we know that there are other risks. There can be genetic factors and other things involved. So it seems that the more times that you ovulate in your life, the higher your risk of breast cancer. So having pregnancies and breastfeeding actually decreases your risk. So you would have thought that taking the combined pill, the pill that contains estrogen, progesterone, and works by stopping you ovulating, would actually decrease your risk of breast cancer. But we've known that it doesn't. There seems to be a small increase when you take the combined pill. And we think that's due to the higher doses of hormones involved, and that risk declines after you stop taking it. But up until now, we didn't know the impact of progesterone only contraception on breast cancer. And that might be a mini pill, a progesterone only pill, an implant, an injection, or a hormone coil. And there are other coils which are copper coils, and they do not contain hormones, and that is not what we're talking about here. So researchers from Oxford University looked at 10,000 women under the age of 50 diagnosed with breast cancer between 1996 and 2017 and looked at their prescription history for contraceptives, hormonal contraceptives. And they compared that to 18,000 women of the same age who were not diagnosed with breast cancer. And from that, they showed that all forms of hormonal contraception increase your risk of breast cancer by somewhere between 23 and 32%. But the numbers are really relevant because the numbers are small. And that's because breast cancer is rare under the age of 30. 8 out of 10 cases are over the age of 50. So they estimated that for every 100,000 women aged 35 who use a form of hormonal contraception for 5 years, that there will be an extra 265 cases of breast cancer. 265 out of 100,000. And if you were younger, between the ages of 16 and 20, there's an extra 8 cases per 100,000. So your risk was small. And there is a slight increased risk, but the overall risk is still small. And everything in life, everything in medicine, and I say this a lot, has to be a balance between potential risks and potential benefits. And we need to view it in the context of these. So what are the risks of pregnancy? Well, deep vein thrombosis, blood clot in the leg, pulmonary embolus, blood clot in the lung, high blood pressure, preeclampsia, gestational diabetes, infections, preterm labor, miscarriage, stillbirth, the risks associated with labor and delivery, hyperemesis, which is extreme vomiting in pregnancy, mental health issues such as depression and anxiety. And there are risks of unwanted pregnancy, which maybe has an increased mental health burden as well. Plus, we don't necessarily use hormonal contraceptions solely for the purposes of contraception. We use them for lots of other reasons, and those reasons might be having a real impact on the quality of someone's life. So we use them to treat heavy periods, very painful periods, PMS, headaches and migraines which are related to your menstrual cycle, PMDD, premenstrual dysmorphic disorder, endometriosis, and more. And the pill has benefits in that it decreases your risks of other forms of cancer, such as ovarian cancer and womb cancer. So what we need to do is, as women, we need to be able to make our own choices based on the risks and benefits that we find for our own personal medical history. So I welcome studies like this because they help us make those informed choices. For anybody out there who is worried, I hope that helped to show that your risk was small and that there is still a slight increased risk. But when we put it into context for you, the benefits may well continue to outweigh those risks.